Interatrial block is not that common in the general population. In the atherosclerosis risk in communities, a RIC study involving 14,625 patients, interatrial block was detected in 0.5% at baseline and 1.3% developed interatrial block during a follow-up of about 6 years. The study showed that interatrial block was associated with increased risk of atrial fibrillation with a hazard ratio of 3.09. Bayes syndrome is third-degree interatrial block with paroxysmal supraventricular arrhythmias. There is association with increased risk of ischemic stroke and cardiac death. Interatrial block has been shown to correlate directly with structural remodeling and a decrease in the absolute value of strain rate during left atrial booster pump function and early reservoir period determined using speckle tracking echocardiography.
Just as there are sinoatrial and atrioventricular blocks, there is also something known as intraatrial block and interatrial block. These are less well-known entities which can be recognized electrocardiographically. And finally, there is something known as Bayes syndrome, which can occur as a sequelae of interatrial conduction block. This is the normal P wave in inferior leads. When it is wide and notched, it can be partial interatrial block if there is no evidence of left atrial enlargement on imaging studies. That is P mitral like morphology without associated left atrial enlargement on imaging studies. Occasionally, this can also be associated with left atrial enlargement. Then differentiation will be difficult. In advanced type of interatrial block, there are wide biphasic P waves. That is how it is represented. This is the diagrammatic representation of intraatrial conduction system. There are three pathways between sinus node and AV node. They are the Wengi-Back, Thorel and Bachmann's. A part of Bachmann's bundle also reaches the left atrium through the roof of the atria. It's occurring in the upper part. This is Bachmann's bundle. Bachmann's bundle is also used for pacing. Bachmann's bundle pacing. If it is done in this region, there is synchrony between the two atria. P waves will be narrower than in normal case. So this is the anatomy of the interatrial and intraatrial conduction system. This is not well known usually, and these are not as well defined as the intraventricular conduction system like the His bundle and the bundle branches and fascicles. Now we will review the classification of interatrial block. First degree interatrial block, P wave duration more than 120 milliseconds that we have seen in the previous diagram. Third degree interatrial block, longer P wave duration with biphasic P waves in inferior leads. Second half is negative, that also we have seen in the diagram. Then third degree interatrial block, these abnormalities are seen transiently in same ECG and is known as atrial aberrancy. This is almost similar to the grades of AV block and SA block. Here is the explanation for the wide biphasic P wave in advanced interatrial block. Terminal negative component of P wave in inferior leads is due to delayed activation of the left atrium from below upwards, secondary to block in Bachmann's interatrial bundle in the upper part. You see, this is the Bachmann's bundle in the upper part. So normal activation, right atrium is activated first and left atrium after that. So you will have a positive P wave in inferior leads. Inferior leads are in this region. So anything activation going downwards will be represented as positive in inferior leads. So both these activations are downwards, even though initial part is due to right atrium, second part is due to left atrium. That's why in left atrial enlargement, the P becomes notched due to extra activation in the latter part of the P wave. While when there is a Bachmann's bundle block, there is again delayed activation of the left atrium, but in a different direction when the bundle is totally blocked. When Bachmann's bundle is totally blocked, right atrium gets activated this way, contributing to the initial component of the P wave, and left atrium gets activated in a retrograde direction. As the activation proceeds from here, then it goes up. That's why the terminal portion of P wave is negative in advanced or total Bachmann's bundle block. Now, what is Bayes syndrome? It is third degree interatrial block associated with paroxysmal supraventricular arrhythmias, described by Professor Bayes de Luna. Third degree interatrial block with paroxysmal supraventricular arrhythmias is known as Bayes syndrome.